Should asymptomatic H. pylori be treated with antibiotics? Imagine discovering you have a bacteria living in your stomach, but you feel perfectly fine. Should you rush to treat it with antibiotics? That's a common question when it comes to Helicobacter pylori or H. pylori. Current medical guidelines suggest that if you have no symptoms and no related stomach issues, routine antibiotic treatment isn't usually recommended. The main reason to treat H. pylori is if it's causing problems like peptic ulcers or certain stomach cancers. When H. pylori infects the stomach lining, it can lead to ulcers by damaging the protective mucus layer. Eradicating the bacteria often helps ulcers heal and reduces the chance of them coming back. But if you carry H. pylori without symptoms or ulcers, the benefits of antibiotics are less clear. Many people with asymptomatic infections never develop ulcers or other complications. Treating everyone with H. pylori regardless of symptoms could expose people to unnecessary risks. Antibiotics can cause side effects like nausea, diarrhea, or allergic reactions. Plus, overuse of antibiotics can lead to resistance, making future infections harder to treat. It can also disturb the natural balance of bacteria in your gut. Guidelines from organizations like the American College of Gastroenterology recommend treating H. pylori only when there's a clear reason, such as confirmed peptic ulcers, gastritis with symptoms, or a family history of stomach cancer. Before treatment, testing is usually done through breath, stool, or blood tests, and after treatment, a follow-up test is recommended at least for weeks later to confirm the bacteria has been eradicated. Deciding whether to treat asymptomatic H. pylori should be a personalized decision made with a healthcare professional. They will consider your individual risk factors, such as age, family history, and local antibiotic resistance patterns. In some cases, especially if you have risk factors for stomach cancer, your doctor might suggest treatment even without symptoms. In summary, from the perspective of ulcers and peptic ulcer disease, antibiotics are recommended when there's clear evidence of infection causing problems. For people without symptoms or related conditions, most guidelines advise against routine treatment. It's always best to discuss your specific situation with a healthcare provider to make an informed choice. Remember, medical decisions are personal and should be tailored to your health needs.